Good morning and hello, everyone, and welcome to our joint webinar with Arizona Hispanic Chamber of Commerce. I'm Mike Greger, and I lead the commercial sales team at Blue Cross Blue Shield, and I'm privileged to be with you this morning. We are so glad you joined us today to discuss our expanded partnership with the Arizona Hispanic Chamber as we introduce our new health plan, Cultivate. Monica and the team at Arizona Hispanic Chamber have been great partners of ours through the years. Our team has had the pleasure of working closely with them to develop Cultivate, and we are glad to have the opportunity to speak to the Arizona Hispanic Chamber membership today. Why Cultivate? We at Blue Cross Blue Shield of Arizona routinely hear from small business the need for more health insurance options. Also, Blue Cross Blue Shield of Arizona understands the need to support the Hispanic community here in Arizona, and especially Hispanic business, small business. This is where our partnership with Arizona Hispanic Chamber comes in. We work together to support Hispanic small business and attract and retain talent through benefit options and help these businesses grow. I'll be your MC today, and we have a few housekeeping notes for you. First of all, at the end of today's presentation, we're going to have a drawing for 2 Phoenix Suns tickets for the upcoming season to be held at the end of the webinar. And you have to be present to win, because we gather up all the names that are of the people attending, and we put them essentially in a wheel, spin it out, and we get a winner. So hopefully you can stay for the balance of the program and get into the drawing at the end. The webinar will last about an hour. There will be an opportunity for Q&A at the end of the presentation. You'll see that there is a Q&A button. So if you want to just put your questions in there, I'll gather them up and we'll review them as a team at the end. All the attendees are muted and the chat feature is turned off at this point, but the Q&A is available. This webinar will be recorded, and communication on how to access it will be sent out from the Arizona Hispanic Chamber. There will be a survey following the webinar, so any feedback that you may have or additional questions that you think of would be welcome. So moving forward with today's program. Our agenda for today, first of all, we have a number of speakers who will be joining us, and we'll have some upfront remarks from some of them, then we'll get into the product discussion with the Blue Cross Blue Shield team. Next up will be Paige Rothermel, who's our Chief Operating Officer. Then Deanna Salazar, our Chief Administrative Officer and General Counsel, will have a few remarks. And then Monica Villalobos, the President and CEO of the Chamber, will be welcoming all of you. Tomas Leon, President of Quality Health, will be next. Then James Jerome, a Senior Product Manager at Blue Cross, will be running through the product offering. And then Marla Bauer, who works on our individual team, will be talking about the options on the individual side as well. Then we're going to have some Q&A, and then we'll get you out of here on time. So thanks again for joining. So with that, I would like to welcome Paige Rothermel to the program. Good morning, Paige. Paige, you're on mute.
I apologize. I thought I hit the button. Good morning, Mike, and thank you. And good morning, everyone. I am thrilled to have the opportunity to be here today with all of you to introduce the new Cultivate program that the team has been working on for the greater part of probably over a year with the Hispanic Chamber. And I want to thank everyone who has been dedicated to making sure that we got to this point today, and we're excited to share with you the new and exciting programs that are available. I'm the Chief Operating Officer for Blue Cross Blue Shield of Arizona. My responsibility includes all of our lines of business, from individual all the way through our newest line of business, which is Medicaid. And I have been here for about 3.5 years and have had a great opportunity to get to know the Arizona market and really spend some time understanding the unique needs of this market. And clearly the Hispanic Chamber is a significant part of the success of this organization, as of the state, as are all of you. So in a very competitive market that we work in today, we're really focused on understanding the unique needs of our customers, and that's how Cultivate came to be. Really uncovering those unique opportunities for us to better serve and reach more Hispanic Arizonans in a different way, but also help the economy grow, as you all are such a significant part of the growth of this state. And so by partnering with the Chamber, we're actually bringing to you a unique offering for the small group market that will specifically target your unique needs. And you'll hear more about that later from both James and Marla. So a little bit about the economic impact. I think we have all, as leaders, gone through some significant challenges over the last 18 months with COVID and how we have had to transition from where we are all working face to face, and in some cases having to deal with some very unique challenges as employers and as business owners. And so when you think about what we're up against now, it's really about turning the economy into a growth economy and continuing to ride the wave of growth. And in Arizona, it's really, we've seen some incredible growth of Hispanic-owned businesses that all of you have contributed to, and there is a 34% increase in the number of Hispanic-owned businesses here in the state, and it's critically important for us to be able to provide you the unique benefits and services that we offer to be able to help you remain competitive, attract talent in this incredibly competitive talent market that we're in. And as you think about just in general, Phoenix as a market, the Phoenix market has coming up on almost 1 million Hispanic residents. So when you think about the growth opportunity, it is very, very obvious that we need to be in the space, and we need to do it differently than anyone else has been doing it. So that's why we're here today, to share with you our new offering. And so I would also like to really congratulate the Arizona Chamber and all of the work that you have done to keep all of these small businesses operating during this really challenging time, and look for new ways for us to be able to continue to attract talent, continue to grow, and continue to serve more and more Arizonans across the state. So with that, I want to say thank you again and to turn it back over to Mike for the rest of the program. So have a great day, and thank you all.
Thank you, Paige. That was great. Jump it back on here. Okay. All right. And up next, we have Deanna Salazar who will be joining us. Deanna, are you available?
I am. I'm here, Mike. Thank you, and good morning. Buenos días a todos. Es un placer estar aquí con ustedes. It's great to be here with everybody. We've been longtime partners of the Arizona Hispanic Chamber, and I can tell you that in my role at Blue Cross, I've been here for 23 years. One of the great things I get to do is to help guide the company in investing in other organizations that share our mission of making Arizona healthier. And when we talk about the health of our state, we're talking about more than just the physical and mental health of our state. And I know that you're going to hear more about that today, but we're talking about healthy communities. We invest to ensure that every child in Arizona has a quality education, regardless of where that child lives. And we have made ensuring minority student success a pillar of our diversity pledge that we've made to the community. So we've invested heavily in minority scholarships for Arizona students. Healthy communities mean safe communities. Healthy communities mean affordable housing. And healthy communities, I think we all understand, and that's why we're here today, means economic prosperity for everybody. Over the past couple of years, as Paige mentioned, it's been very challenging for everybody. I don't need to say that. But we've tried to rally resources and partner with organizations in the state to make sure that our community continues to thrive economically. Last year we partnered, for example, with Chicanos por la Causa, and by doing that, we pumped $5 million into the market in PPE funds for small businesses. We've worked with Local First Arizona to provide micro grants to minority and women-owned businesses to ensure that they can be prosperous during these very challenging times. And really importantly, we've had a relationship with the Arizona Hispanic Chamber that's lasted more than 2 decades. That's as far as our records go back. I couldn't find it any further back than that, but we've invested well over $700,000 with the chamber to help drive economic prosperity in our state. So this is a great partnership. We're excited to be here today and to look for ways to continue to make you successful and to grow your businesses in challenging times when we know that those partnerships are so crucial to making everybody successful. So I'm excited to hear the presentation today. Thank you all for being here. And you all know that if there's anything that I can do to help you, you will reach out. I hope you'll reach out to me. Mike, I'll turn it back over to you.
Thank you very much, Deanna. And next up is Monica. There she is. How are you?
Great. Thank you so much, Mike. Really appreciate this opportunity, and a warm welcome to all of our members that are on with us. We are very excited about this opportunity to be able to share with our partners, with our members, the work we've been doing with our partners. This has really been a labor of love for all of us, I think, for the last 2 years. When we rolled out information on healthcare and that those 2 or 3 years ago, one of the things that we realized is that 40% of small businesses state that their greatest challenge is providing healthcare for their employees. And so we went to work, and it was Blue Cross Blue Shield who stepped up and said, you know, we want to help you solve this problem. And they really did. This is a game changer for us as a chamber. It's a game changer for all of our members, for all minority-owned businesses and small businesses that really want to be able to provide health care, but because in the past it's been cost prohibitive, we are excited to be able to roll this out again with our partners at Blue Cross Blue Shield of Arizona. Cultivate is really meant to meet small businesses where they are with regard to budget and to provide that critical source of healthcare for their employees. We all know that a healthy workforce is a productive workforce. And so again, we just at the Arizona Hispanic Chamber of Commerce want to thank Blue Cross Blue Shield of Arizona for your work. There are a lot of people behind this. Paige, Mike, your teams have been phenomenal working with us and really understanding the needs of our members. And we want to make sure that this is something that we can provide to all of our members, to minority-owned businesses, to small businesses in Arizona. And I know you all have gone to great lengths to be flexible to make sure that we have a plan, some kind of a plan, whether you're a sole proprietor, whether you're a family-owned business, whether you've got 2 to 50 employees, or even if you're a 1099 contractor. So Blue Cross Blue Shield of Arizona is all about solutions, and we are so proud to have partnered with you. I'd like to introduce my board member and president of the Equality Health Foundation, Tomas Leon, to provide even more context on why this is so significant and such a game changer for the Arizona Hispanic Chamber and for small businesses in Arizona. Thank you.
Gracias, Mónica. Appreciate that. And muy bienvenidos a todos aquí para este junto. It's an honor to be here with you on behalf of the board members at the Arizona Hispanic Chamber of Commerce. I'm honored to be here and be part of this milestone and this special announcement here, given that it's the Hispanic Heritage Month celebration. And so we, in addition to all the extensive research that we did together with Blue Cross Blue Shield on the needs of Hispanic businesses relative to health and wellness, we also participated in engaging some of the Arizona Hispanic Chamber of Commerce members in some focus groups to really understand the needs and the challenges facing small businesses and their employees. So I want to give a shout out and a big thank you, un gracias, to all of the chamber members that participated in those focus groups that helped guide our work. This is truly a groundbreaking partnership that's bringing unique health plans to Arizona Hispanic Chamber members. And this is a unique opportunity for us to add value to your membership so that we can help you succeed in starting up and growing and expanding your business. And our goal for this work really centered on affordability and access and quality, so Hispanic-owned businesses you have what you need to cultivate a healthy and productive workforce. And I want to send a shout out to one of our board members, longstanding board members, Mr. Tony Astorga, who's been an advisor and a guide through this process to get to this point. So thank you, Tony, for your sage advice and guidance that you've given us. And then finally, this is all about supporting entrepreneurs who are working so hard to serve your customers, your clients, create jobs, and drive economic growth. And we know that Hispanic entrepreneurs have been driving a big driver of the economy, not just in Arizona, but across the country, and are going to be key to helping us in the pandemic recovery. So thank you for joining us. We look forward to supporting your workforce and cultivating a healthy and productive workforce. So gracias, and a big thank you to our creative and purpose-driven team at Blue Cross Blue Shield for helping us realize this idea and made it a reality that we're bringing here today to you. Thank you so much.
I appreciate that, Tomas and Monica. It was quite a project, but it was fun to collaborate, and we all learned a lot through the process. So we're excited about where we are today, and that allows us to transition to the meat of the program right now, and move toward a description of the product. And James Jerome, who's a senior manager on our product team on the commercial side here at Blue Cross Blue Shield, and who really knows this material very well, is here to guide us through that. So welcome, James.
Thank you, Mike.
Mm-hmm.
And if you can move to the next slide, Mike. Offering health insurance to your employees is an investment in your business. And I'd like to start today by covering two big competitive advantages you can gain for your business by offering health insurance. First of all, health insurance will help you attract and retain key talent. And you may have encountered this already with your business. Experts are calling 2021 the year of the Great Resignation, as employees are voluntarily leaving their jobs to search for something new in unprecedented numbers. Health benefits can be a very effective recruiting tool to ensure you are attracting the best employees that you can to help your business succeed. In addition, employees who are offered health insurance tend to be much more satisfied with their employer, meaning you are more likely to hold on to the employees you have today. In addition, health insurance will help you maintain a healthy and productive workplace. Studies indicate that healthy workers are nearly 3 times more productive than their unhealthy peers, while unhealthy workers take up to 9 times the amount of sick leave each year. Anything that you can do to help keep your employees healthy will pay off for your business. Studies also indicate that workers who do have health coverage miss on average 52% fewer work days than uninsured workers. Next slide, please. So the key barriers that often stop health insurers or stop small businesses from offering health insurance to their employees are the cost of coverage and the confusion over the options that are available. Blue Cross Blue Shield of Arizona and the Arizona Hispanic Chamber of Commerce are partnering to address these two challenges. So first of all, we are committed to offering affordable options. Blue Cross offers a variety of health plans designed to meet a wide range of price points to effectively meet the needs of your business. So a daycare business employing 4 women under 40, for example, will likely have different healthcare needs than a construction business employing 13 men versus a legal firm or a software development company or an architectural firm. In addition, Blue Cross and the Chamber have met with Hispanic business owners in Arizona to better understand your needs and the needs of your employees and their families. And we are introducing new affordable plan options that we'll cover a little later in the presentation that are designed specifically to meet the needs of chamber members. Health insurance can also be confusing. Blue Cross and the Chamber can connect interested business owners with trusted brokers who are also chamber members and can provide expert assistance to you at no additional cost to you or your business. Next slide, please. So due to regulations, there are two types of health insurance plans that are offered to small businesses. So the first one is small group plans. To be eligible for small group plans, your business needs to have at least one common law employee who is not a family member, and that employee needs to be working at least 30 hours per week. In addition, at least one of those common law employees must opt to enroll in the business's health plan. Now, the other types of plans that are available are plans for sole proprietors, spouse-run businesses, and independent contractors. I am going to start by walking through the small group plan options today, after which my colleague Marla will walk through plans for sole proprietors. I'd like to start walking through the available options through Blue Cross. So health insurance plans from Blue Cross cover the services that most employees want for themselves and their families. So all of our Blue Cross small group plans cover important things such as doctor visits, prescription drugs, preventive care to help keep your employees healthy, as well as outpatient care and hospital stays, as well as maternity, which is very important for many employees. Our plans also cover mental and behavioral health care, and we know as we've made it through the pandemic that mental and behavioral health care is absolutely critical. It's been a very stressful couple of years for all of us. We cover emergency care, urgent care, lab work, rehabilitative services, and we even cover dental and vision care for children. Next slide, please. And so Blue Cross offers a variety of plans, and additional features are available on some or all of our plans that employees will like. And so preventive care is available at no cost to the employee on all of our small group health plans. This means, for example, that annual wellness visits, as well as flu and COVID shots, are available for free if you are a Blue Cross member. Also included on all of our plans are convenient and free or low-cost virtual online medical visits through your computer, your laptop, or even your phone. All of our plans also include free nurse on-call services, so members can talk to a registered nurse any time of day or night in English or in Spanish. Most of our plans are designed to offer low-cost doctor visits to encourage members to receive necessary care. All of our plans cover generic drugs, and many of our plans now include a wide variety of generic drugs that are available for just a $3 copay, reducing the barrier to getting the medications that employees need. Affordable urgent care visits are also offered to keep employees out of the emergency room unless absolutely necessary. And finally, Blue Cross offers plans that can be paired with a health savings account, which offers a tax-advantaged way to save money for future medical expenses. Next slide, please, Mike. So as I mentioned, Blue Cross offers a variety of health plans to meet the varying needs of Arizona businesses, and it can be confusing, but we can put you in touch with brokers who can provide expert assistance in selecting a plan or plans at no cost to you. But I would like to take a minute to talk through three important decisions that you will make as you're considering what plans are right for your business. So first of all, the available plans, we've got two, and these plans are available at a variety of deductible levels. The first plan is the Everyday Health Plan. The Everyday Health Plan offers predictable costs for most doctor visits, common services, and prescription drugs. Then we also offer the portfolio plans. Now, the portfolio plans can be paired with a health savings account, which is a tax advantage way for employees to save money for future medical expenses. So in addition to the available plans, these plans are available in different plan types. One plan type is the PPO. On the PPO plan type, members can visit any doctor or provider for covered services, but will pay the least with a doctor or provider who is within the Blue Cross contracted network. These plans also include out-of-state coverage across the country with the wide and expansive Blue Card network. Then we also offer HMO plans. So HMO plans are plans where members select a primary care physician who manages their care. And members need to receive most services from in-network providers within Arizona. We do offer emergency services that are covered both in and out of network at all providers across the country if needed. HMO plans are generally available at a lower premium cost than PPO plans, so it is a way to help save your business money. Finally, all of our plans are available on a choice of 3 different provider networks. So provider network is the set of contracted doctors, providers, and facilities where members will pay the least for healthcare services. The first network is the broad statewide network. This network includes doctors and providers in every county in Arizona. Network also includes over 2,300 Spanish-speaking providers just in Arizona. If you or your employees have relationships with doctors today, chances are those doctors are in our statewide network. Now, we do offer additional options that can help businesses save money on their health coverage. We offer the Alliance Network, which is an exclusive network that covers the Phoenix metropolitan area and includes providers from Banner Healthcare and Honor Health. The key advantage of the Alliance Network is that premiums on this network are generally 11.5% lower than those with the broad statewide network. So if your employees are locally based in Phoenix, this may be an option that can save money for you and your business. The other exclusive network that we offer is the Pima Connect network. This is an exclusive network that covers the Tucson metropolitan area, includes providers from Tucson Medical Center and Northwest Healthcare. The Pima Connect network offers a savings of 13% from the broad statewide network. Next slide, please. And I'm very excited to announce that for 2022, Blue Cross is offering a set of affordable new plans designed specifically to meet the needs of Arizona Hispanic Chamber members. These new plans are called Cultivate Plans, and these plans include desirable features such as they offer 1 free primary care visit per year to each member, in addition to the no-cost preventive visits that are already available. This free visit encourages members to find and build a relationship with a primary care doctor so they can maintain their health, receive recommended care, and necessary screenings. And so this is something we developed as we talked with Hispanic business owners in Arizona. They said many of their employees don't visit the doctor on a regular basis, and they wait until they get sick and maybe need to go to the emergency room. And so the idea is to reduce the barrier to doctor visits, to encourage members to build that relationship with a provider who can help them maintain their health. Multiple benefit designs are available within the Cultivate options for different price points. And each of these Cultivate plans are more affordable than similar options from Blue Cross by focusing on the benefits that business owners indicated were most important to their employees. The Cultivate plans are available both as PPO or as HMO options, and they are available with the 3 networks that I talked through earlier: the broad statewide network that includes national coverage, the Alliance Network, which is located in Phoenix, or the Pima Connect network, which is located in Tucson. So all plans, both from Blue Cross and from other companies, include limitations and exclusions. So I wanted to take a moment to call out that in addition to knowing what is covered by your plan, it is very important to understand what is not covered. And your broker can help you understand the details on what is and what is not covered by your plan. Blue Cross creates materials that are available that go into more detail on both the benefits that are covered as well as the exclusions within each plan. And Blue Cross is also available if you have any questions on what is covered and what is not covered. So if you are interested in exploring health insurance options brought to you by Blue Cross in partnership with the Arizona Hispanic Chamber, we encourage you to visit today at azblue.com/cultivate. We can get you in touch with a health insurance broker. Again, these brokers are experts on Blue Cross plan offerings, and they are also members of the Arizona Hispanic Chamber. The broker can explain available options and help you select a health insurance plan or plans that best fit the needs of your business and your employees. The broker can answer any questions that you have and can talk through additional health benefits that we have available through Blue Cross if you're interested, such as dental insurance or life insurance. So thank you for your time today. And with that, I am going to turn the presentation back to Mike.
Thank you, James, and well done. That was very thorough, and appreciate it, and agree with you that the focus groups were exceptionally helpful as we constructed these plans and come up with some differentiated attributes for each one of these. So with that, why don't we transition next to Marla Bauer. Marla is here representing our individual segment. She's a marketing manager with Blue Cross Blue Shield. Welcome, Marla.
Good morning. So I'm going to share with you our individual and family Affordable Care Act plans. So if you are a sole proprietor and you're not eligible for a small group plan, so what's the definition of sole proprietor? If you're a business that takes an income, but you don't have any employees. So freelancer, a consultant, an independent contractor, or other self-employed worker. Next slide. So one thing on the individual health plans is need to know when you buy insurance. This is different than small group. Open enrollment is a time when anyone can enroll. So that's November 1st through January 15th. If you purchase before December 15th, your coverage will start January 1st. If you purchase between December 15th and January 15th, your coverage will start February 1st. And the coverage is available for the calendar year through December 31st. So if there's a reason you can't purchase during open enrollment, there is an opportunity to purchase year-round through a special enrollment period, which means you must have a qualifying life event, such as losing your coverage. So sorry, my dog.
That's
but,
great.
Life events are happening right now.
That's right.
So coverage, having a baby, getting married, if you moved. So those types of things, you're eligible to buy at any time. You must show documentation, and your coverage start date will depend on that specific qualifying event. With individual and family insurance, one thing to be really cognizant about is that there are subsidies and tax credits available to lower the cost of health insurance. So financial help is available to pay either all or part of your premium, as well as out-of-pocket costs for doctor visits and prescription drugs. And the amount of financial help is dependent on your household size, as well as your annual household income. The federal government increased financial help this year, which now 9 out of 10 Arizonans qualify for financial help. And so to give a real life example, let's say you're a family of 4 and you bring in about $75,000 a year, you live in Maricopa County, you could be eligible up to $1,000 a month to help pay for your costs. So definitely work with your broker to ensure you're getting the financial help that will help lower your costs. And similar to what James described in the small group plans, 10 essential health benefits are also covered in all of our Affordable Care Act plans, such as doctor visits, prescription drugs, hospital stays, urgent care, and even dental and vision care for your children. As well as we've got several free or low cost benefits in all of our plans. James mentioned the free primary care visits in small group plans. We've extended this on our plans. Some of our plans have unlimited free primary care provider visits, and all of them have at least 2 primary care provider visits. In addition, there's still free preventive care for your wellness checks and flu shots, free online medical visits, available 24/7, free nurse online call to talk to a registered nurse. All of our tier 1 generic drugs are $0 or up to $3 including things such as mental health, diabetes, and heart conditions, to ensure that these folks get low-cost prescription drugs that are needed. There's also discounts on health services and equipment such as vision services, wearable fitness devices, and more. So I'm going to walk through the 5 plans that we have available at a high level. And I think in the individual market, it gets really challenging because there's a lot of plans to choose from. So we've done a really good job of identifying different health needs and different budget needs to make it easy to find the plan that's right for you. So our first plan here is our PPO plan. For someone who wants a lot of choice and freedom to select the doctors that they want. So this is the largest network of providers to choose from, with no specialist referrals, out of network care, and out of state. So if you're traveling with your business or personally, you get care in every US zip code. Our advanced health plan is for those that really don't see the doctor often, may take a generic prescription drug, but overall really healthy and just wants that catastrophic coverage when something happens. This is our lowest cost plan for just in case. Our everyday health plan is kind of your traditional health plan, and this is similar to the small group plan that James mentioned. So it's got predictable out-of-pocket costs for every budget. There's 3 deductible levels, and there's copays for doctor visits, as well as generic drugs. So if you visit the doctor often or take generic prescription drugs, this plan would be right for you. Our true health plan is for those that really need specialist care or brand name drugs. So if you or someone in your family does have a complex health condition, see the doctor often, this plan is the perfect fit. It has the unlimited primary care provider visits at no cost, as well as fixed copays for specialist doctors and brand name drugs. And then the last plan, our portfolio, is our health savings account plan. So if you are that health planner and want control over how you spend your dollars and want the tax advantage, the portfolio HSA plan is correct. So our HMO network, so if you're looking at an HMO plan, there's 3 networks, depending on where you live. Our Maricopa Focus network are for those that live in Maricopa County. Our Pima Focus is for those that live in Pima County. And then Neighborhood is for anyone who lives outside of Maricopa County or Pima County and has coverage throughout the state. Our PPO network, so if you're looking at the PPO plan, it's the broadest provider network in the state of Arizona, covering 96% of the providers and 98% of hospitals in the state of Arizona. And as James mentioned, it does have Blue Card, so you've got coverage in every US zip code if you travel outside of the state. And just as James mentioned, every one of our plans, as well as other carriers, have limitations and exclusions. So definitely work with your broker to make sure you understand what's covered and what's not covered to ensure you get the right care. And also, if you're interested, as James mentioned, for small group or these individual plans, feel free to go to azblue.com/cultivate and let us know what you're interested in. We'll make sure we point you in the right direction.
Excellent. Okay, thank you, Marla. How are you? We're doing well on time, everyone, so that's fantastic. So thanks, everybody. And now we're moving on to the Q&A portion of our program. And we do have some questions that have come in. So James and Marla, maybe it'd be best if you could rejoin the broadcast here and we can maybe go through a couple of these. I have one, I think for you, James. I have a family-owned business of 3, my husband, my 16-year-old, and me. Do I qualify?
Yeah, so great question, Mike. So this family business wouldn't qualify for a small group plan because for a small group plan, you need to have 1 W-2 common law employee that is not a family member. But they would absolutely qualify for the individual options that are available for family-run businesses that Marla walked through today.
We did get another question here that came in through the Q&A. Will we get a summary of plan coverage options that we can review?
Yeah, that is absolutely available both for small group plans and for the individual plans for sole proprietors or family-run businesses. So we create health plan guides that walk through the details on all of the plans. If you do visit azblue.com/cultivate, we can get you in touch with someone who can give you all of the information that you need on those plans.
Okay. And they're coming in pretty fast now. This is great. I'm glad to see all the questions from the audience. For an employer with 2 employees, one being full-time, do I qualify?
Yeah, and so great question. And again, it depends on whether that other employee is what's considered a common law employee. And so generally that means, not a family member, full-time, working 30 hours a week, and they would need to opt in for coverage. But if there's any questions on that, the broker that we can get you in touch with is very familiar with all of the rules and can help you through that.
Great. Thank you, James. Here's another one. Although Cultivate is offered to the Arizona Hispanic Chamber members and minority businesses, will this be open to other small businesses too, or are there other plans available?
Yeah, another great question. So the Cultivate plans that we put out there today are really designed specifically for Arizona Hispanic Chamber members, but we do offer a lot of plans for small groups that are available, to small businesses of any size. And it's the same on the individual side. Maybe Marla can speak to that, but we've got plan options that are designed for pretty much any, small business that's available.
Excellent. Here's another question. Does the chamber have a specific broker to call? Are the rates for members of the Hispanic Chamber discounted?
Yeah, another great question. So this is where we would love to provide the chamber specific discount, but there are regulations that are in place that prevent us from doing that. And so what we've done for the Hispanic Chamber is we do have the Blue Cross options, that are available to the entire market. But then we've created the Cultivate plans, which are a separate set of plans that are marketed just to Arizona Hispanic Chamber members. These are the plans that we designed based on the focus group with Arizona Hispanic-owned businesses. And so these plans are available at a lower cost than any of the similar plans available through Blue Cross.
Mm-hmm.
And in terms of, sorry, Mike, I missed the first part of that question. In terms of a specific broker to call, the recommendation would be to call azblue.com, /cultivate. Go to that website, and we can get you in touch with, a broker who can assist you.
Okay. Scrolling, is the small group plan prices at age banded rates, or does the plan charge the same rate for an individual or family plan?
Yeah, another great question. So in the small group market, the pricing for insurance is based on a couple of factors. And so it's based, clearly on the plan that you choose, but also based on the location where the business is headquartered, in what county in Arizona the business is headquartered. And then for the people that are on the plan, it does include age as a factor from pricing, but not gender.
Okay. Here's another one. We have an LLC. There's only my wife and I. We are low income. How do we qualify?
Yeah, I don't know, Marla, if you wanted to take that one.
Mm-hmm.
Yeah, no, that's a great question. You are eligible for an individual and family plan. As I mentioned, 9 out of 10 Arizonans get financial help. So I would definitely take a look at what plans are available and the financial help that'll help pay for that. There are 2 types of financial help. One is help that will pay for the monthly premium. And if you qualify, there's also additional subsidies that are available to pay for your out-of-pocket costs to lower your deductibles and your co-pays. So I would definitely work with the broker to take a look at the individual plans that offer financial help.
Right. If we have a PPO plan, can we have people from around the country involved?
So I'll start with the small group plans, and then Marla can take the plans for sole proprietors. On the small group side, the answer is absolutely. And so a big chunk of, even though we're Blue Cross Blue Shield of Arizona, a big portion of our business are employees of companies that are based here but live in other states.
Yeah, and on the individual side, you do have to be an Arizona resident, but our PPO plan offers the opportunity if you travel part of the year in different states, or you live part-time in different locations, that plan would be best for you. Or another alternative too, I know this gets beyond the business side of it, but if you have college-age students who live out of state, that would be eligible as well.
As a small business owner with 4 staff members, I personally don't need the insurance, but my employees do. Can I get coverage for them without including me in the plan?
Yep. Yes, that is definitely an option.
Okay. Yeah, a lot of these are on the small business side and just about eligibility. What if only 1 or 2 employees that want coverage, but the others don't? Do all employees have to sign up? I guess that talks about our minimum requirements on that piece, James.
Yeah, and so on this one, my recommendation would be to get in touch with the broker and talk through that in more detail. There are different options available depending on whether you're, or different regulations that apply whether you're within the open enrollment period or not. So my recommendation would be to get in touch with the broker and talk about, which health insurance options would be appropriate.
Okay. If I own 3, oops, some of these questions just disappeared. Is there a best practice for finding a broker? You know what, James, I'm going to take this one. So what I would recommend for this one is if you would reach out to Christina at the chamber and just let her know that you're looking for a broker. We can coordinate with her to provide some recommendations. We also already have some that are aligned as Arizona Hispanic Chamber members, and she can provide you with that list. And if that works for you, then that problem is solved. But if you want to go deeper, certainly the team at Blue Cross Blue Shield can help you with that. Okay. Looks like adult dental and vision is included. Does Blue Cross Blue Shield have resources for us to reach out to adult dental and vision plans?
Yeah, absolutely. And so, if you do get in touch with the broker, Blue Cross offers Blue branded dental plans today that are available to small businesses. And then the broker can help you figure out what vision plan would be best for you and for your business. Yep, absolutely. Great question. I will say that dental benefits in particular are extremely popular, in small businesses in general and their employees, but also within our focus groups with the Hispanic business owners.
Okay. There was also another question here regarding a very specific condition that probably a better spot would be to call Blue Cross Blue Shield directly to talk to them about the potential for coverage for that condition. That would probably be the best way to expedite an answer on that one. So thank you for the viewer for sending that one in. Okay, and I think that brings us to the end of the Q&A section. I want to thank the audience for a very robust session. I think we had about almost 20 questions. So that's fantastic. James, Marla, thank you so much for stepping in there and helping work through those answers. I'm certain that after the conclusion of this webinar, other questions will come to you. And certainly if you want to reach out to Christina at the chamber with your questions, that would be great. If you go to ezblue.com/cultivate, there'll be a spot there for you to ask questions as well. Then we'll be able to answer those too. All right, and we're coming to the end of our presentation. Again, here are the ways to find out more information about the Cultivate program. We're very excited about the launch. We're just beginning. So, we're just getting started. So we're waiting to see how this resonates with the the Hispanic community, but we're really optimistic that we think we've hit on something and will be useful to small business specifically. And with that, we have a drawing. So Tico, I'm going to stop sharing my screen. And if you want to push up the wheel, we will we'll do our drawing. How's that? Okay, look at this. This is technology at work, ladies and gentlemen. So this is kind of fun. So these are the folks who are on the webinar right now, and around we go. Krista Sham, you are the winner. 2 Suns tickets coming your way. So we'll pass those along to the chamber, and they'll get those off to you. So thank you so much for joining today, and you get two Suns tickets coming up for the new season, and it's going to be the place to be for the next few months. So well done and congratulations on that. Okay, so with that, I think we're at we've come to the end of our program today. We've covered a lot of material. As I mentioned earlier, you'll probably have questions afterward. We certainly have plenty of folks around who can help with those answers. And we're really excited about the launch and the partnership with the Chamber. It's been a lot of work, but it's been a great labor together, and we're excited about where we go from here. I don't have any other comments at this point, so I'd like to thank everyone for joining us today. I know it's a very busy time of the year. We'll let you get back to the rest of your day. And thank you for joining us today as we launch our new program, Cultivate. Enjoy the rest of your day. Thank you.